Feeling sad, feeling down, and even feeling depressed are normal human feelings that we can have whenever there is a stressful situation, maybe a loss, a failure, a setback that could be academically, financially, in a relationship. So when we say that this is a normal depression, day-to-day depression because of some stress, or a clinical depression that requires further treatment and a psychiatric assessment. So when we call what is a clinical depression or a major depressive episode, what that means is that a person needs to feel sad or down or depressed for almost every day, for most of the day, for at least 2 weeks or so. And during those 2 weeks duration, along with feeling depression, person may have loss of interest in their usual activities. For example, if they enjoyed going out, playing some sports, or watching some movie, or doing something for fun, but now they have been noticing that it's not only that they are feeling sad or down, but they don't find enjoyment, they don't find the motivation, they won't find activities that used to be fun anymore. Plus, there can be change in their sleep. They may be sleeping too much, sleeping less, waking up early in the morning, like way earlier than they were expected to wake up. There may be change in their appetite. It can be a decreased appetite, increased appetite, similarly change in weight. It can be gaining weight, losing weight, along with feeling hopeless, helpless, worthless, not wanting to live, wanting to die. What's the point of trying? There is nothing good anymore. So negative thinking about themselves, about people around them, about world, and when those, and at severe cases, there may be thinking of killing themselves, having suicidal thoughts. So when someone is having feeling depression for every day, most of the day, for consecutive 2 weeks, plus 5 of the symptoms that I mentioned, feeling hopeless, helpless, worthless, not wanting to live, lost interest in their fun activities, doesn't enjoy, wanting to die, having active or passive suicidal ideation, then we can call it as a clinical depression, or we can call it as a major depressive episode. And if someone has one episode any point in their life, mean they have had a major depressive disorder, they may be in remission, mean they may not have been having active symptoms right now, but because of in their history, they have had this episode one time, maybe a previous year or 2 years ago. It's important to realize that if we don't get proper treatment, like maybe psychotherapy or talking to someone, or if the depression is really bad to the point, that they are actively, their depression is affecting their day-to-day functioning, then maybe along with therapy, medication. So if they don't get the appropriate treatment, first, they will struggle in their day-to-day functioning, and then they may be more likely to have second episodes later in their life. Many times what I have seen, people may come that, I have had 2 or 3 major depressive episodes that I mentioned, but no, I am feeling fine. Why there is a need to take medication? I don't feel like taking it. I am perfectly fine. I'm happy. I'm enjoying it. So my answer to those questions are that the medication, after you have had a couple of episodes, even if you are doing better, it's important to take even now, because these medications are not only treating the current symptoms, but also when you don't have symptoms right now, it prevents further episodes to happen. So the need for treatment is when the symptoms are significant enough that it's impairing your day-to-day functioning, or you don't feel like going to work, it's affecting your relationship, you are having some significant negative thoughts. I will encourage to see your primary care to get a referral or to see a psychiatrist or therapist. Sometimes it's important to start both medication and therapy. And sometimes when symptoms are mild, mild mean that you have all those symptoms, but those are not that much significant, then maybe starting with therapy alone and see if you need medication later in your life. Thank you.